Good morning, everyone. Live from Freedom Physical Therapy Services in Fox Point, Wisconsin. Mike Karegeannes here, physical therapist and owner. Just wanted to take a few minutes today to educate you on whiplash-related injuries, neck pain that can occur from that ever unfortunate car accident that inevitably some of us might encounter, better known as motor vehicle crashes or cervical acceleration, deceleration injuries. Keep in mind too, even something like a slip and fall this time of year in the winter, where you might unfortunately fall backwards on your back, that same mechanism can cause neck-related issues, maybe even concussion-related symptoms as well. So I wanted to just highlight some of the symptoms you might experience following a motor vehicle crash, and of course the severity of the symptoms can depend on the impact and the magnitude of the car crash, and of course symptoms can vary. But in general, and through some good research, about 2 in 3 of you, if you do get in an accident, will typically feel neck-related symptoms within the first 6 hours. Then usually over 90% will experience symptoms within 24 hours, and then almost 100% of you will experience symptoms within 72 or 3 days. So sometimes it's important, even when you early on after the accident might not experience symptoms, it's probably wise to seek out some care and treatment and an assessment to make sure that you're going to be okay. Symptoms might typically include, of course, just initially neck pain in front as well as in back, headaches, maybe some migrainous-related symptoms, dizziness can happen, maybe some vestibular balance-related issues, eye-related symptoms, blurry vision, and when things are more progressive or the accident is more impactful, maybe some arm-related symptoms, hand numbness, tingling, and even possibly down into the legs. So these are areas you just want to be mindful of and aware of, and make sure that you get looked at. And of course, in the lovely state of Wisconsin, as physical therapists, we have something known as direct access. Most of us treat spine significantly in all of our practices, and with direct access, you can come in and see us. We can do an assessment, take a good look at things, make sure your ligaments have not been affected, and then appropriately help you find a physician or other healthcare consultants that can be part of the team to make sure we get you recovered and well. Some people, 20 to 40% of the population, can have symptoms several years beyond the accident, and unfortunately maybe 3 to 4% can become somewhat disabled and maybe never return to work. So we're going to take a moment here to watch this awesome video that I was able to find by the Atlanta Whiplash doctor. So first of all, a big shout out to them and thank you for working in conjunction with Dr. Arthur Croft, which many of you may or may not know. He's kind of been a long-term leading authority and has done a lot of great research in whiplash and the effects and the injuries that can occur. Again, keep in mind, a lot of times we talk about the neck, but not uncommon to have, even though your head might not hit anywhere inside that vehicle, you can still suffer concussion-related symptoms. We call it minimal brain trauma that oftentimes goes undiagnosed and missed. And then, of course, one of my areas of expertise that I love to treat a ton of is the temporomandibular joint. And this is our jaw joint. We have one, of course, on both sides. And this is your condylar head in the joint, but obviously the ligaments can get disrupted as well when your mouth might get traumatized in the whiplash mechanism, which we're going to see shortly. There's a little disc inside of here that can become dislodged, and of course just muscle-related pain, whether it's in the jaw, the face, or of course your neck area. So we're going to head over to my laptop here, and again, big shout out to this Atlanta Whiplash orthopedic docs and Dr. Arthur Croft for really putting one of the more accurate representations of actually what goes on during a motor vehicle accident. Here we go.
Welcome to this video demonstration of whiplash. Whiplash, also known as cervical acceleration-deceleration syndrome, can be described in 4 phases. In phase 1, the seat impacts the torso. The head position increases vertically, and an abnormal S-curve develops in the cervical spine. In phase 2, the neck hyperextends and the head strikes the seat. This causes injury to the tissues of the front of the neck. Phase 3 occurs when the passenger moves forward, rebounding from the seat, followed by forward acceleration of the head. In the final phase, the seatbelt restrains the torso. The head, however, continues forward, forcing the neck into hyperflexion. This injures tissues of the back of the neck. It is widely considered the most damaging phase.
So again, big shout out to the Atlanta Whiplash docs and Dr. Arthur Croft for putting that animation together. I think it does a quick summary and a nice synopsis of what can happen. And just to highlight a few things, we talked about the TM joint, of course, that can be traumatized. Here's just kind of a little model of course, if this was the back of our head, the base of our skull, and our upper cervical spine. There's some very important ligaments in this area, the alar ligament and transverse ligament, that we certainly want to assess, definitely before any deep work would ever be done, and certainly before any manipulation would ever be done, to make sure those have not been traumatized or stretched. That might create some instability in your cervical spine. And then these little guys over here are called the facet joints. This is your first, we call this your atlas. This is your axis, and of course your third cervical vertebrae. And these little joints in here that help guide and glide our movement to bend our head forward, backward, sideways, or rotate. Those can get traumatized or impacted. You can have joint swelling in that area. Here's a little bit, obviously, bigger representation of the back of our cervical spine. There are 7 cervical vertebrae, and the front of our cervical spine. As many of you are probably familiar with the disc that is in between there, unfortunately, those can become herniated or ruptured at times if the impact is great enough. And then, again, the various joints, the facet joints. And then through here, we call this the foramen. That is where some of our nerve roots can come out, and occasionally those nerves can get pinched or irritated or inflamed and be part of the reason why you might have symptoms down into your shoulder, your tricep, your bicep, or your hand. So, and of course, on top of all of this is the muscle, which is very important to treat and look at. Again, the front of the neck, the back of the neck, shoulder blades, and of course the facial area. All those areas you want to look at and treat. So just going to give you one quick tidbit. If you have suffered from this, we're going to have Molly lay down here real quick and show you one of the main muscles we do spend a lot of time treating in the clinic that can become impacted and injured from the cervical acceleration, deceleration injuries. So one of the major muscles that can get traumatized is this one right here. We call this your sternocleidomastoid. Molly's going to just lift her head up to make it much more prominent. It attaches down into your sternum here, but all the way up into the base of your occiput here on something called the mastoid bone. And that can certainly be hidden with a lot of myofascial pain and trigger points that can also, when that's involved, mimic and cause head-related symptoms or facial symptoms, as well as sometimes down the arm. Now, here's the tidbit. A lot of time, and especially for you therapists out there, which you might be wondering, why isn't this area fully resolving? And again, it can occur on both sides, is there's then a portion of the sternocleidomastoid, that's the clavicular portion, which is over here. Molly's going to just make hers a little bit more apparent. This is the clavicular portion and division. And sometimes this is an area that can get neglected in addition to the scalenes and other areas, but that will get missed. And oftentimes when you look that closely and you're very specific with your treatment, not only to this area, but of course the back of the neck and other areas and tissues that might be involved, you should have a much more successful outcome. So be safe out there, drive safe, wear your seatbelt. We're going to be showing some things later down the road about where that seatbelt should be placed, hand placement on the steering wheel, the distance you should be from the center of the steering column in your chest, because God forbid if that airbag goes off at 200 miles an hour, folks, if your hands are not in that 9 and 3 o'clock position, you could also suffer pretty severe injuries to the wrists and hands, but it can be fatal for those of you that are within 10 inches from your chest to that steering column, and if that airbag goes off, it could be fatal to you, even though it's designed to protect you. Seatbelts by far are the safest. The airbag is just meant to be one additional safety feature in that vehicle as well. So drive safe, walk safe out there with the winter time and the ice and the snow, and happy holidays from all of us at Freedom.